Welcome to What Your GP Doesn't Tell You, the podcast for both doctors and patients with me, Liz Tucker. This week, I'm talking to oncologist Professor Robert Thomas, who argues that along with standard conventional cancer treatments, all of which he uses, that exercise and diet can play a pivotal role in improving outcomes. And in this particular episode, we're very much looking at the dietary interventions. Robert says for the newer biological therapies, which require a patient to have robust immunity, research is revealing that a healthier lifestyle and gut can improve the chances of responding well to these biological agents by 30 to 40%. And just to add, in our conversation, Robert discusses studies using several probiotic supplements, one of which has also been shown to help those with long COVID. You can find all the details of these in the podcast show notes. The podcast receives no financial benefit or incentive from any of the companies listed. But before we get to the details of Robert's interview, a brief request from me. If you enjoy this podcast and would like to leave a review on Spotify or Apple, that would be much appreciated. It really helps. You can also become a paid supporter of the podcast at patreon.com/whatyourgpdoesn'ttell-you or via PayPal on my website, whatyourgpdoesn'ttell-you.com. A huge amount of work goes into both the research and production of this podcast, so even a small amount of money makes a huge difference. And you can find out more information about the pod on my website, where you can sign up for the podcast mailing list, follow me on Twitter at Liz C. Tucker, and on my Substack account, liz.tucker.substack.com. Many thanks. And now back to Robert's interview. Professor Robert Thomas is a consultant oncologist at Bedford and Addenbrooke's Cambridge University Hospital Trusts. He specialises in the treatment of breast, colorectal, bladder and prostate cancer. For his achievements, Robert has been awarded the British Oncology Association Oncologist of the Year, the Hospital Doctor magazine Doctor of the Year, the NHS Communication Research Award and the Royal College Frank Ellis Medal. And he's the author of How to Live, the groundbreaking lifestyle guide to keep you healthy, fit, and free of illness, published by Short Books. Here's Robert's interview. Well, Robert, many thanks for sparing the time to join the podcast today.
You're welcome. Thank you, Liz, for having me on the show.
Now, you're a conventionally trained oncologist. You use all the standard treatment approaches, but you argue that in addition to this, things like diet and exercise can actually play a really important role in treatment, not just in well-being, but in actually affecting the disease. And I wondered what all your colleagues think. Are they supportive, or some of them are a little bit more sceptical and think, oh, it's all a bit woo-woo?
Yes, as you said, I'm a mainstream oncologist. I give radiotherapy, I give chemotherapy every day, all the biologicals and immunotherapies. But on top of that, I run a research lab looking at trying to find the evidence for exercise, nutritional intervention, gut health, or anything a patient might be interested to help themselves prepare, do better on treatments, and recover after treatments. And you are quite right. We've been doing this for 25 years, so it's not as if we've jumped on the lifestyle bandwagon. You know, in the early days, yes, there were scoffs at the back of the lecture theatre from my colleagues in Cambridge. I always remember a study where we looked at exercise levels during radiotherapy, and we showed that people who exercised more have lower toxicities. Many of the private radiotherapy units have actually built gyms next to their radiotherapy suites to improve outcomes. So yes, in the early days, there was a lot more scoffing. More recently, with the biological treatments, which require the immunity to be very efficient, we're showing that if you have a better lifestyle and better gut health, you've got a 30 to 40% increased chance of responding well to these biological agents. All of a sudden, oncologists are waking up to the fact that this massive improvement in response rates are occurring when you've prehabilitated, when you've prepared the patient better. And in fact, the president of ASCO stood up last year and said, we need to be taking prehabilitation for oncology treatments, gut health, very seriously.
And Robert, for people who don't know what ASCO is, could you explain?
ASCO is the world's largest cancer conference. It's in Chicago every year. 44,000 oncologists get there. Anything new or anything important is discussed and presented there. So if the president stands up and says, this is important, it really is very important. And he said gut health and lifestyle interventions to improve biological treatments is a priority. So, when you've got that backing behind you, all of a sudden what you've been doing for 30 years is now mainstream.
So you feel vindicated?
Well, yes, I do a bit. There's a great case report from Germany which summarized it. Someone who was given a PD-L1 inhibitor, a treatment for metastatic melanoma. They fell to pieces, they had diarrhea, they ended up with pulmonary fibrosis on a ventilator, fortunately recovered. This was about 5 years ago. The patient took it on themselves. They did actually have a small response, even though they had one cycle. Say, I'm going to look to see what I can do to help myself. They then improved the gut health. They changed the diet completely, cut out processed, all the things we'll talk about in a minute. They restarted the treatment, had a brilliant response, and is continuing to do so. The question is, why wasn't that patient put in a prehabilitation program before the start of it? And that is still happening around the world. Patients are just seeing the oncologist, they're prescribing the drugs, they're not giving adequate preparation, and the patients are not responding as well and getting more side effects. And that's what we've got to change.
Now, Robert, we tend to use the word cancer as a catch-all, and in fact, as you know, it covers so many diseases. So when you talk about this huge improvement in effectiveness for drugs, is that across all cancers, or are there some cancers that are particularly affected by lifestyle?
Most of the data comes from the common tumours because there are more of those patients around. So a lot of the early data, say, for exercise after the end of adjuvant treatments or treatments to try and get rid of the cancer comes from bowel cancer. But then from there, prostate, breast, and other tumours, the data's been very clear. For the gut health, they tend to be tumours where we're using biological treatment. So initially that was things like melanoma, but now we're using them more and more across the board. Okay, the data might be stronger for the more common tumours, but it clearly applies to all tumours.
And for diet, is there a difference in terms of what we eat for the prevention of cancer rather than when we actually have the disease? When we actually have the disease, does that require a more intensive approach?
There are some disparities in certain foods which seem to work better for prevention and preventing recurrence or improving response rates. But on the whole, to keep things simple, they're pretty much the same.
So key really to following a cancer prevention diet is including lots of vegetables and fruit in my diet due to the phytochemicals that they contain. Can you explain exactly what these phytochemicals are?
Yeah, when we were in medical school, we never talked about phytochemicals. We talked about vitamins, minerals, proteins, etc. So this is sort of relatively new thing. And as you know, phytochemicals are natural substances which occur in largely plants, particularly ones with a strong color, taste, and aroma. They make foods taste nicer, look nicer, but they have enormous health benefits. And there's about 20 different categories of them. Some have more anti-inflammatory properties, some have more ability to enhance oxidative pathways, some have direct anti-proliferative, slow down cancer cells directly. So they have enormous benefits. There's a number of different mechanisms of how they work. First of all, they act as prebiotics, so they help gut health, which then improves gut integrity. You don't get leaky gut. They have direct anti-inflammatory properties, not only in the gut, but when they're absorbed into the body. And we know that excess inflammation encourages cells to divide faster. It causes hypertrophy. And when cells divide faster, they don't have enough time to repair themselves, and they create more energy, so they get more free radicals. They don't have time to repair themselves, so they get more oxidative stress and more genetic damage. And if those cells then survive, if they're not picked up by the immunity, that's the start of cancer. So that's why inflammation is bad. On top of that, as I just mentioned, they help enhance oxidative pathways. So when you get more free radicals around, maybe because you've eaten some carcinogenic food or you've produced more energy because you're overweight or have got hypertrophy, you're able to mop up these excess free radicals. But unlike direct antioxidants, such as vitamin A or vitamin E, they actually switch off oxidative pathways when they're not needed. So the old expression antioxidants is not correct when you speak about phytochemicals now. They enhance antioxidant pathways is what you want. On top of that, they slow the transfer of glucose through the gut wall. So they reduce the impact, the glycemic index of other foods. So which is good because we don't want sugar hitting the bloodstream fast because that also triggers rises in insulin, and insulin promotes cancer cells to grow faster. It goes on and on. On the biochemical part side, they have been shown to reduce proliferation of cancer cells, so slow the growth of cancer cells, but not slow the growth of ordinary cells. They promote apoptosis.
That's cell death.
Yeah, so they encourage cancer cells to die. Some have been linked to reduction in cancer cell migration, so preventing metastases. Most of this latter things I've talked about is from cell line and animal data. But we know from clinical studies, absolutely positively, populations who eat more phytochemicals in their diet, lots more herbs, spices, vegetables, mushrooms, things like that, have a lower risk of cancer and a lower risk of cancer relapse.
Isn't it sometimes quite difficult with these studies because somebody who is wealthy might eat more fruit and vegetables? They might have other aspects of their life which are healthy beyond just a diet. Sometimes these comparative studies in food can be quite difficult.
Absolutely right. And that's why some of these studies show conflicting data, which the press love, because they can say suddenly broccoli is not healthy or something. There was a study from Minneapolis which suggested tea promotes cancer, which didn't fit with anything. Tea is a very healthy drink.
Sure.
We did an analysis of a data set with 155,000 people over 12 years. And all we wanted to show is, does tea increase or decrease the risk of prostate cancer? And my goodness, it took almost 3 years to complete because we had to get every other variable. Maybe rich people eat more tea. Maybe if you smoke, you have less tea. Maybe if you don't exercise. We had to look at every other variable known to cause cancer. So yeah, you can factor in these variables, but it's difficult. We did actually show about a 2% reduction in prostate cancer if you're a tea drinker. So it wasn't rocket science, but we managed to show it if we did the analysis properly.
And what type of tea was that, Robert?
Actually, both. I mean, green tea is probably a little bit more healthy than ordinary black builder's tea, but there is still lots of phytochemicals in ordinary tea. If you like ordinary tea, then I wouldn't stop that.
And what happens if people add milk to it?
We looked at that in a data set. That didn't seem to make a lot of difference. Adding sugar, however, completely mitigated any benefit from tea.
I'm sure it does.
Yeah. First thing I say to my patients, let's talk about your sugar intake. And the first thing I say, do you add sugar in your tea or coffee? And I strongly persuade them to stop. Because as you know, within a month, your taste buds have changed. You wonder why you ever added it.
Now, there are certain vegetables and fruit that you think are particularly valuable. Unfortunately for me, one of those is beetroot, which is a vegetable I absolutely loathe. It goes back to school when we used to have stewed beetroot with macaroni cheese.
Ooh.
And I've never quite got over it.
I blame you.
So what is it about vegetables like beetroot which make them so effective?
Well, beetroot's an interesting one. It's packed full of phytochemicals because of its deep red color. It's actually very strong in nitrates. Now, nitrates in plants, because they're not, well, maybe your stewed beetroot might not be so beneficial, but usually they're not cooked to very high temperatures. They, in the presence of other phytochemicals, are converted into nitric oxide, which is a vasodilator and improves blood supply to organs. That's why athletes and cyclists have a lot of these nitrate-rich foods. The trick with those, you don't want to really overdo it too much with nitrates, to be honest. So there is a school of thought, you have too much, it could be counterproductive. For example, when we did our original prostate study, we wanted to look at foods which had some cell line and some animal and maybe some early human studies. And the things we looked at was cruciferous vegetables such as broccoli, asparagus, and then herbs such as turmeric, which isn't absorbed that well. The idea is you should diversify the foods because each of these phytochemicals perhaps have a different mode of action. So just having a load of turmeric, you're going to get a little bit of benefit. You're not going to get more benefit by taking more.
Is it absorbed better if you have it with pepper? Because a lot of the supplements supply it with pepper, don't they?
Yeah, it's not absorbed that well.
Yeah.
Most of the benefit actually comes from improving gut health. It's a very good prebiotic and it reduces inflammation in gut cells. So you may not need to absorb it, to be honest. And pepperin has a lot of interactions with other drugs and other pathways. So in our latest study, for example, when we were trying to find the best supplement with the latest evidence, we didn't include pepperin because it actually works by delaying excretion rather than increasing absorption anyway. What we did find improves absorption of not only turmeric, but many other foods is ginger. Ginger is a natural bioenhancer. So it not only helps its own phytochemicals get absorbed, it helps the phytochemicals in other foods being absorbed. So in our latest supplement, for example, we wanted to diversify the amount of phytochemicals all working synergistically together. And the ones we chose, broccoli, turmeric, green tea, pomegranate, cranberry, and ginger. Obviously, we can't put too many foods into a capsule. In terms of diet, lots more cruciferous vegetables, lots more herbs and spices, teas, berries, and fruit. And that sort of covers it. But on top of that, we'd also recommend things like mushrooms, nuts. They also would help to diversify the diet.
Now, classically, we've had the sort of 5 a day, which is a bit of a kind of stick a finger in the air and come up with a number. Do you think that's high enough, or should we be eating many more vegetables and fruit than that?
There is lots of conflicting evidence of this. There was a study a few years ago by Pierce, which says that if breast cancer survivors, if they had more than the 5 a day, they seemed to have a lower risk of relapse. There was another study more recently saying that it didn't make a lot of difference. So it depends on, the quality of the vegetable.
And I suppose if you were eating fruit that was very high in sugar, that might be a negative, possibly.
It's difficult with sugar because if you correlate sugar intake with risk of diabetes, for example, there isn't a correlation of more diabetes. In fact, it's slightly less.
You're excluding processed sugar. You're just talking about the sugar and fruit.
Yeah, there's some caveats there. Obviously, processed sugar is very, very bad. It's absorbed very quickly. It feeds the unhealthy bacteria in the gut. And pro-inflammatory bacteria love sugar. Anti-inflammatory bacteria love polyphenols and phytochemicals, and that's what they feed off. So in fruit, you have polyphenols and phytochemicals and about 14% sugar. So on balance, you're feeding the healthy bacteria. The phytochemicals slow the transport of sugar across the gut wall naturally. So the glycemic index of fruit is low. If you, however, put them in smoothies and things like that, you're breaking them down and increasing the sugar ratio. So I wouldn't recommend smoothie, but whole fruits generally are very, very healthy. And I wouldn't discourage people from eating them at all, unlike processed sugar and processed carbohydrates, of course.
But the point is, if you have an orange juice, you might have as much sugar as if you were eating a soft drink or drinking a soft drink.
Absolutely. I mean, orange juice is a classic example. They've broken it all down. They've got rid of all the pulp, which slows the glycemic index. You've got rid of a lot of the phytochemicals as well, like the citrus bioflavones are actually in the pulp of the orange, not the juice. So you've got rid of all the healthy parts and you've magnified the sugary part.
I don't drink it, but I do miss it. I still think it tastes lovely.
Well, it depends. If you have a small orange juice, which is freshly squeezed, and you have it at the same time as a meal with other phytochemicals in, probably, it's got lots of vitamin C and other minerals as well. I wouldn't ban it from your diet. I mean, there's a lot more unhealthy things we can do than having a small glass of freshly squeezed orange juice.
True. And when it comes to cooking fruit and vegetables, I'm assuming that's quite important in terms of preserving their nutrients.
Yeah, phytochemicals are fairly robust for heat. That's why, for example, if you cook tomatoes and concentrate them, put them in tomato sauce, the lycopene, which is one of the main phytochemicals, is largely preserved. It doesn't get any better. It is denatured a little bit, but you increase the concentration by cooking, don't you? So
Sure.
You couldn't eat that many tomatoes as you get in a tomato sauce. But that says some phytochemicals are denatured. So, like all things, it's not black and white. Some are denatured. So the less cooking you do, the better. So raw fruit is generally better. But of course, you have to eat a lot more of it. It's particularly if you cook at high temperatures. So if you're frying things or heating them in the oven is particularly bad. And the other thing about cooking vegetables and fruit in the oven, it is quite a very high temperature, and the sugar within the vegetables and fruit can be converted into acrylamides. And that's why things like vegetable crisps, I really not a fan of, because they're very, very high in acrylamides.
So if I'm roasting vegetables in the oven, which I might do at 180 or 200, which I do quite often, that's basically going to be causing problems.
Yeah, again, it's a balance. There's lots of healthy things in vegetables, even if you cook them, but you are damaging some of the phytochemicals and you are converting some of the sugars into acrylamides. And I still think acrylamides are carcinogenic, although there is some debate about that.
So if the choice is between frying over a direct heat on a hob and roasting in an oven, is it possible to say that one is better than the other?
Well, probably roasting's a bit better, but do it slower at a lower temperature. When you're on a hob, I mean, it's very high temperatures, isn't it?
Sure. Yeah, no, absolutely. But I'm just thinking your classic casserole, I'm a keen cook, so I'm just interested. Your classic casserole, you fry the first elements in the pan, and then you add all the various other elements, and then you stick it in the oven. But you fry your onions and your garlic first, your other vegetables.
Yeah, I mean, it depends how you fry them. If you fry them where they're completely black and covered in sort of stuff from the frying pan.
I try not to. I'm not sure that's a brilliant taste either.
It's all about slowly simmering. And it's the same with the oils. If you use a healthy oil and you slowly, not smoking or sizzling, it's about just having a gentle heat to put a bit of flavor in it and mixing the herbs with it. Slow cooking is great. You can use a slow cooker, which cooks over 4 or 5 hours, is much better than a very high, fast heat.
And when we say healthy oils, we mean things like extra virgin olive oil, avocado oil.
Yeah, things like that. I mean, people say you shouldn't use extra virgin olive oil when you're frying, but it depends how you fry it. I would still use it, but fry it at a lower temperature.
Because it has a lower smoke point than normal olive oil.
Yeah, and you can denature the polyphenol. So you could argue it's just a cost issue. If you fry, don't use an olive oil which costs £12 a bottle. Use something cheaper.
Now, Robert, you've done several studies looking at gut health and prostate cancer. The first was using a supplement called Pomi-T, which was a mixture of pomegranate, turmeric, tea, and broccoli. What exactly have you found?
Okay, so that study was 13 years ago when these interventions were in their infancy. There were some phase 1 studies, phase 2 studies, and some animal studies. So we just put together a scientific committee, got some government funding. We did a double-blind randomized trial of what you just said against placebo. We saw a 64% slowing in the PSA progression, which is a marker of prostate cancer progression. Since then, we've realized that gut health is very important for prostate cancer development and progression. So we worked together with some patient advocacy groups, and we said, look, we want to do an intervention to improve gut health. And so we used a lactobacillus probiotic with vitamin D and prebiotic called inulin. That was what we initially wanted to design this time. However, the prostate patient said, well, hang on a minute, you've already just said you need to stop all other supplements. We don't want to stop our phytochemical rich supplement, whether it was Pomi-T or another one, because you've already told us it's good for us. We thought, well, let's use all the data we've had over the last 10 years and see if we could do a supplement which has got all the latest data. So we used the initial ingredients of the Pomi-T, which was the turmeric, pomegranate, tea, and broccoli. We said, well, what other data is there? There was a good study looking at cranberry, reducing PSA, and men with prostate cancer often have urinary symptoms, and cranberry is good for that. And as I've mentioned, ginger is a good bioenhancer. We didn't want to use pepperin because we didn't think the data is that strong anyway, and it interferes with lots of drugs. Many men who are on prostate cancer are on lots of drugs, so we wanted to avoid that. We put together one which is now called Phyto-V. It contains 6 ingredients. It also is the only supplement in this field which uses the whole foods, which is dried and concentrated. And then we look at the type of phytochemicals within each food and say, which is the one which probably had the most benefit? So we concentrated the amount of phytochemicals by adding specific extracts. So it's got specific extracts and whole foods. And then in the study, we gave all men that. So we could say, you don't need to stop anything else. We'll give you what is now regarded as the best phytochemical-rich supplement. Then on top of that, we randomized giving them a probiotic or not. So we were on the same even platform. And then when we get the data, we're able to spot whether the probiotics actually made a difference. And we're not only measuring PSA, we're measuring MRI changes, we're measuring erectile function, urinary symptoms, and strength. We want to see if it's making them stronger.
And are you able to report anything yet?
We did an interim analysis, and what we were very pleased about, because we recorded the PSA doubling time in the 3 or 4 months pre-trial and post-trial, there was a very significant reduction in the rate of progression. So we already know that. So for the cohort as a whole, and we also know that the curves are splitting. So there is a difference between the placebo and the probiotics. The trouble is, it's a blinded study. Although we finished recruiting, we haven't finished the analysis. So we're not able to say just yet whether the probiotics was the group which had the even better reduction in PSA. But very excitingly, we've seen now about a 20% improvement in erectile function and about a 40% improvement in urinary symptoms, which has not been shown before. And what we think is that the improvement in gut health is reducing inflammation in the body, including the prostate and other organs, and improving symptoms, which is really satisfying to see.
So very significant, potentially.
Yeah, the group as a whole, we already know, because we've done the analysis on that, is already highly significantly benefiting, but we don't know whether the probiotics are adding to that even further.
And one of the things this podcast always looks at are financial interests. So can I just ask, do you have any financial interests in any of the supplements that you've tested?
For the Your Phyto and the Your Gut Plus, these are both supplied to us by 2 separate companies. And no, those are nothing to do with me. 10 years after the trial finished and it was published, a family member did become one of the distributors, but I'm nothing to do with POMT now anyway. So that was a lame. What we do is we, as a scientific committee, we look to see what we want. Well, then we put it out to tender and we say, well, who can supply us? Surprisingly, most people say they don't want to, because a lot of the trials would be negative. They're quite expensive. If there is a statistical improvement, then they have the right to sell it, a quid pro quo. And, don't forget, the profit margins of these are quite small.
Yeah.
So, it's not like a drug which they're making millions and millions. It's not a massive interest for them, and they have made the risk. So I'm very happy to work with small companies in order to create funding. Otherwise, these trials wouldn't happen.
But potentially the market might actually be much bigger if the final results correlate with what you're expecting. That's a significant improvement. But I suppose there isn't anything to stop another manufacturer creating a similar supplement.
Yeah. Say, for example, the probiotic is what we suggest. It's going to add it. The first thing we do is tell people how to improve their gut health. So although in the intervention we've used a supplement because we can objectify it and we can quantify it, the bottom line is that gut health helps. So we will give them dietary advice, eating more kimchi, eating less processed sugar, running more, eating more phytochemical-rich food, having some bacteria in your diet. That's the take-home message. So the majority of people won't go on and we know this from the trial. Most don't go on and often buy the probiotic. They change their lifestyle to improve their gut health. Secondly, the same thing happened with the COVID study because we used the same supplement, Your Gut Plus, in the COVID study, which showed a significant benefit. People just went out and bought any probiotic, which is not scientifically that correct.
This is a study you did looking at gut health in long COVID patients.
Yeah, so it ended up, it was mainly a long COVID study, double-blind randomized trial. So we used what is now called Your Gut Plus, but it was just a blind packet in the study, which contained mainly lactobacillus, inulin, and vitamin D. We showed a very significant improvement in the recovery of symptoms, not only in the gut, but other symptoms such as abnormal smell, fatigue. It was life-changing for some people. But people just went out and then bought any supplement which they get off the counter. So in theory, yes, they do get some sales, but not like a drug which can be patented and protected intellectually. So if people criticize the company who sells us saying they're in it for a quick buck, they're not actually. Yeah, there is some potential benefit, but that's why drug companies aren't interested in supplying us with products which can't be intellectually protected.
One thing you mentioned, but we haven't really discussed, are fermented vegetables. Why are they so important? I'm thinking sauerkraut, kimchi, things like that.
So there's lots of reasons, mainly that they're packed full of bacteria. Kimchi is good because it's mainly live. If you buy a good kimchi and you open the lid, it fizzes, because the bacteria are in there. They're still discovering new bacteria in some kimchis. Sauerkraut, there's a big debate. Most sauerkraut is pasteurized. So although it was fermented, it's then pasteurized, so all the bacteria are killed. There's a big thing at the moment saying, well, actually, you still get some of the benefit because you've got the killed bacteria, you've got the fragments of bacteria which will improve gut health. But I still think live is better. Probiotics, for example, in capsules, although they're in a dormant phase, when they're then mixed with water, they do start growing. So they're able to ferment in your gut. Fermented foods tend to have lots of vitamin K2, which is good for getting the fat into where the cells are and improving vitamin D absorption.
So look at the side of your yogurt carton and make sure it contains live bacteria.
Absolutely. I mean, a lot of patients say, I take yogurt, and say, well, is it live yogurt? Quite often they don't know. So I said, well, make sure you do. Lots of Greek yogurts aren't live, for example. Fermented cheeses. We're not very good in Britain, actually, of having fermented foods. As a diet, the population, we don't do that much. And that's why certainly in the studies, I use probiotics. And certainly I use probiotics when I'm traveling or if I've been ill for some reason, where my diet's been particularly as good as it should be. I think there is a role for probiotics, especially if you don't eat a lot of live bacterial-rich foods. You mustn't forget is you've got to have prebiotic foods with it. So beans, mushrooms, vegetables. A lot of patients come back to me and say, look, but I'm getting wind, I feel a bit bloated. I said, yeah, but just get through that. If you have a meal with leeks, asparagus, mushrooms, and beans, you're going to get bloated. If you introduce those in the diet, within 2 weeks, that extra fermentation in your gut, that extra wind disappears. You've got to sort of almost get through that barrier, and then you can eat as many as you want. And that's why things like the FODMAP diet, which I'm very much against, all the data FODMAP's diet are within like a month of having it. Well, of course, if you've got bloating and you reduce all the things which produce gas, fermentation, you're going to feel instantly better. But in the long term, it's going to damage your gut health. So you might get a short-term benefit, but you actually, in the long term, it gets worse. So I'm recommending people basically the opposite of a FODMAP diet.
Just give yourself a bit of time to adjust.
Correct.
I think one thing that a lot of cancer patients are concerned about is dairy. I mean, we've mentioned yogurt. What's your view about dairy in general?
Again, it's a little bit overstated in terms of the evidence. It is quite fatty. So if you're struggling with your weight, milk and cheese and yogurt can be quite fattening. That's something to consider. Cows are given antibiotics and growth hormones and things like that. But if you look at the large population studies, a small amount of milk doesn't really correlate with an increased risk of cancer. In fact, for things like bowel cancer, calcium-rich products as cheese and milk actually reduce the risk slightly. So it's like anything. If someone wants to take a little bit of milk in their coffee and tea and have some mature cheese, I would say go ahead. The evidence is not strong. So all these people who get these thongs and pick up a cheese think it's a poisonous object have got the wrong end of the stick.
And does it matter whether it's goat's milk, cow's milk, organic, non-organic?
Well, organic milk certainly has less of the antibiotics and the things we worry about. Not everything you need to go organic. One of the things I think you get a good value is organic milk. I would go for the organic milk for that reason. As we get older, we all tend to get lactose intolerant. And of course, milk in itself, you will get a sort of allergic reaction in your gut against it. So that's why, as we get older, you're better off having a small bit of cheese than milk. And yogurt, the lactose has been fermented away as well, of course. I wouldn't have large quantities of milk as you get older. You will bloat you, and potentially there are some chemicals like hormones and things which aren't so good.
And any difference between, say, goats and cow's milk? Because goat's milk has become increasingly popular.
Yeah, it's supposed to have less lactose and things like that. And it's not just the lactose, of course, there's other proteins in milk which you can be sensitive to. So if you alternate the source of the animal, you're actually alternating the exposure to proteins. So if you have cow's milk for a while, it's probably a good idea to switch to something else, then switch back. It's the same with soya. Many people have enormous benefits from changing to soya milk, as long as there's no sugar in it. But then after a while, you can start getting sensitive to some of the proteins in soya as well. So it's probably good to stop that and going on to something else. So if you have too much of anything all the time, your body's going to react to it.
Just before I sat down to read something you'd written, I'd eaten a char-grilled venison steak. In my defence, I had asparagus and potatoes followed by yogurt and strawberries. But in general, char-grilled meat is not a good thing to eat.
Well, I like the venison choice because most venison have run around and eaten grass. So there's high in omega-3 and polyphenols. So well done. And the animals have generally had a bit of a life before you shot them as well, rather than being penned in a horrible pen. So in terms of animal welfare, good choice. Now, when you fry meat, you get the nitrous amines, basically, or the nitrates in meat. You know, I said before, nitrates in plants get converted to nitric oxide.
Yeah.
In meat, they get converted to nitrous amines, which is highly carcinogenic because you heated it and it reacts to the proteins in meat. Look, you can counterbalance it. You had asparagus, you had vegetables. And we do know, for example, there's studies of people who have barbecued food. If you have them with salads and spices, you do significantly reduce the nitrous amine content. You know, if you had a steak fried to a crisp and you wash that down with a sugary drink and maybe some chips or something, it's all negative. If you don't fry it too much, it's good quality meat, and you have it with vegetables, the risk is significantly lower. And we've got to eat something, so it's, you accept that every meal is going to have some good and bad in it.
And it's interesting because on the podcast, I interview various people who are experts and they use different approaches in their medical treatment. And as you know, ketogenic diets have become increasingly popular for a number of things. For example, there's a long history of using them for epilepsy, particularly in children. And a group of psychiatrists now using them for psychiatric conditions. And also some work in malignant gliomas, a type of brain cancer, which is very difficult to treat. And they will say, much of the research on meat has been poorly reported. It's an important source of protein, supplying nutrients that plants can't, that plants contain anti-nutrients. So how do patients make sense of this?
Yeah, it's tricky. I mean, I think the data is fairly robust. I don't know why people are confused, really. Processed meat, sausages, pork pies, spam, tinned meat, it's completely carcinogenic. It's full of sugar as well as preservatives. So, there's no doubt about that. And if you then fry them as well, you're just making it even worse. Good quality meat. I mean, the latest data said about 3 days a week would be the complete optimum. It'll top up your vitamin B12. It's a good source of protein. Many people like the taste of it. So, it diversifies your taste buds as well. You can get protein from other sources, as you know, kimchi, lentils, chickpeas, cheese. And a lot of people don't use that in their diet. So, of course, if you've got a patient in front of you who's never heard of quinoa or lentils and never uses them, of course, you're going to have to say you introduce a bit of meat. Otherwise, they'll be protein deficient. I would say get your protein from beans and pulses. Just have a little bit of good quality meat, like a bit of venison or something, 3 times a week. Try to have more fish because it's got the omega-3 in as well. But some meats have omega-3 if it's eaten grass. So I think the evidence is quite clear. The more you fry meat, the cheaper it is. The juice coming off the meat, going into a superheated, smoking, you make gravy out of it. You're just pouring more carcinogens on your potatoes. I mean, it's a no-no.
Generally speaking, those sort of functional medicine doctors who are using ketogenic diet would be recommending high quality meat. And is the problem that sometimes some of these studies on meat mix up organic meat, non-organic meat, meat that's been grass-fed, meat that hasn't been grass-fed? And obviously, all the processed meats, I think it's pretty clear, as you say, have a much higher risk.
Yeah, no, none of the studies will differentiate between organic meat and how you cook it. I mean, I've seen the questionnaires usually ask how many meat you eat a week.
Yeah, that might be really important.
Of course, yeah. I mean, we'd need to repeat them if possible. I mean, these studies take 12 years to sort of mature, and then you have to wait to see if they get cancer 12 years later. The perfect diet for me would be to cut out processed carbs. What you don't want is higher than normal sugar levels by having foods with a very rapid glycemic index, like processed carbohydrates, or having a poor gut health, because poor gut health allows sugar to be absorbed very quickly. What that does is create inflammation, and it creates higher insulin levels and eventually leading to insulin resistance. And there are receptors on cancer cells which are promoted to grow with insulin. So that's the biggest bang for your buck. Have lots and lots of vegetables, have meat 3 times a week, making sure you have a meal and then have nothing till your next meal. So your body has a break and you've got it out of your system.
Another dietary approach that has been experimented on in cancer treatment is fasting, and in particular, patients fasting 3 to 4 days before chemotherapy. And some research has suggested this weakens the cancer cells more than the non-cancerous cells and can enhance the effect of chemotherapy. What's your perspective on that?
Well, I wrote a paper on this a few years ago, so hopefully I'm up to date. There was a study, for example, in breast cancer where people who fasted overnight for 13 hours, so regularly, they had a reduced risk of relapse, they had a reduced levels of inflammation in their bloodstream and a reduced levels of hemoglobin HA1C, which is a marker of diabetes. So 13 hours a night is already been shown to be beneficial. So if you want to fast, just have your evening meal a bit earlier. The other thing is gaps between meals. If you have your breakfast at 7:30, you should try to have your lunch, say, at 1:30. Even better, if you can go for a little run or a bit of exercise before your lunch, biologically, you're extending the fast. Because when you're exercising, you're using up sugar, you're using up energy, you're reducing inflammation. So instead of having like 6 hours for your meal, you're biologically extending that to 14, 15 hours. The same overnight. If you can get up in the morning and go for a little run or a jog or do some activity, you're actually extending the fast, extending the benefit of the fast. Back to your question about chemotherapy, there have been some studies. It is interesting that maybe the normal cells are protected by the fasting process, but the cancer cells aren't. They're very much in their infancy. They're using things like fasting mimickers, like Afinitor is a drug which is fasted. Certainly there's instance of nausea seems to be less. There's a place in Phoenix which is actually putting people on treadmills, which will, again, use up the sugar in your bloodstream a bit. They're claiming some success, but to be honest, it's not something I would routine recommend. I think it's not good to have a large meal just before your chemotherapy because your sugar levels will be quite high. But I don't think we're out there yet to say that fasting before chemotherapy improves outcomes.
But if a patient wanted to try it as a sort of N=1 experiment, you wouldn't necessarily dissuade them.
So it depends on the patient. If a patient is overweight or is worried about weight gain, which happens a lot in chemotherapy, fasting does actually reduce the overall calorie intake, and it's a good way to keep the weight down. So that's good. But you might have some patients who are a bit cachexic, who are struggling with their weight, thinking of fasting, and that would be very counterproductive.
So, Robert, if I make you NHS Health Secretary, what are you going to change in the UK provision of cancer services?
Well, good question. And it's very topical with the election. What we need to do is get rehabilitation for cancer treatments mainstream. At the moment, it's all a bit ad hoc. There is a private company called Genesis who've got gyms in their radiotherapy suites now, and all patients are seen by an exercise professional. They're seen by a nutritionalist. They're told all the things we've talked about, cutting out sugar, etc., and given an exercise program during their treatments. They all love it. They do better. They have less side effects and their outcomes are better. That should be routine in the NHS. Now, obviously, they'll look at the investments. But, there are ways to integrate it. I led the Macmillan exercise program. We just need to speed up the process. We in Bedford, for example, have the university and we can refer all patients to the university, and their exercise students can help our patients and also get data from them, so it's useful. But that has to be mainstream. It can't be an ad hoc process. And what we'll see more people responding to treatment, having less side effects, and we'll see outcomes improving. There was a study recently published, I don't know if you saw it, saying we have the worst cancer outcomes in Europe. We were something like 7% behind Norway, mainly. I mean, Norway is the richest country in Europe, mind you, so it's a bit unfair because everyone's going to be lower than Norway, aren't they? And everyone is saying that's because cancer services is bad. I don't agree with that because we have the same drugs as Norway and we can use them.
But I mean, if you just look in the last year or so, Robert, the wait times for some common cancers for NHS patients has gone up.
Possibly, but it was more patient by patient, stage by stage. They were saying once they met oncology, they were worse. But my take on it is that in Norway, they are better prepared. They exercise more, they have a lower rate of obesity, and they have better gut health. So if we could get our patients to do just those three things, not just when they've got cancer at any stage, our outcome, I think, would pick up. At the moment, it's not taken seriously enough. You have to start treatments quite quickly often. While they're waiting, you could have exercise professionals chatting to them, you could have nutritionalists chatting to them. And it's not just before treatment, it's all the way through treatment. As a population, I'm afraid, we don't perform that well. We've got the highest instance of childhood alcohol intake, the highest instance of vaping, we've got the lowest exercise levels. So we're on a losing wicket, basically. So no wonder our outcomes are worse.
Well, on that slightly depressing thought, Robert, thank you so much for talking today.
That's very kind of you. Enjoyed every minute.
Thank you. Goodbye.
Goodbye.
Hope you enjoyed the latest episode of the podcast. And if you've enjoyed the show, if you could leave a review, that would be much appreciated. It really helps. Many thanks for listening. Bye for now.